Hello. My name is Gina Northington, and it is my pleasure to introduce my distinguished guest, Dr. Marianna Alperin, who, alongside her, I served as a co-editor of the ebook titled Pelvic Floor, Foundational Science and Mechanistic Insights for a Shared Disease Model. Dr. Alperin, as the inaugural chair of the American Urogynecologic Society Basic Science Subcommittee and the International Urogynecologic Association Basic Science Special Interest Group, you have been instrumental in increasing the role of basic scientists in both of these organizations, as well as increasing the visibility of the great work done by our basic science members. Allow me to congratulate you on leading this effort between AUGS and IUGA, where you amassed an international group of 23 scientists to author this ebook and highlight a shared disease model for pelvic organ prolapse and stress urinary incontinence. As you and I both noted in the executive summary, which was published jointly in the Urogynecology Journal and the International Urogynecology Journal last month, there's a large body of data highlighting the epidemiological risk factors of pelvic organ prolapse and stress urinary incontinence. However, the basic pathogenesis of these disorders are still poorly understood. And this has really impaired our ability to significantly reduce the failure rate of some of our common treatments, as well as provide preventative strategies. Dr. Marianna, Dr. Alperin, I always call you Marianna. Dr. Alperin, how did you decide what the important points were to highlight in this ebook?
Well, thank you so much, Dr. Northington, for that introduction. And I just want to start by saying what a pleasure it was to work with this distinguished team of writers, and it would not be possible without doing it together with you and the section editors and all the members of the writing group and their expertise. How did we decide what's important? Well, as Dr. Delancey highlighted in the ebook's foreword, it is difficult in the beginning to know what's most important and what is less important. And as evidence is gathered, it must be evaluated as an evolving body of information to look for patterns that will eventually become a deep knowledge of the disease process. So this living ebook seeks to begin this important task of gathering and summarizing the rapidly growing body of facts currently known about the causes of pelvic floor disorders, specifically pelvic organ prolapse and stress incontinence, and begin the process of forming an overall evidence-based disease model for fitting these facts together.
So I know this was a work that took quite a few years to really get to the point where we were ready for publication. Were there any areas of controversy while you were developing this?
You know, as you were there along the way with me, I think that we were fortuitous to avoid the controversy because from the beginning, we started out as a very multidisciplinary effort, and we really did want multiple points of view that come from individuals whose expertise really was as broad as muscle physiology and immunology and biomechanics and anatomy and urogynecology, urology, et cetera. And so I think that because our writing group and the think tank that took place in 2019 at the joint IUGA-AUGS meeting, I think because we from the start embraced this multidisciplinary approach, it allowed us to avoid the controversy.
Yes, and I highly agree with you. I think one of the strengths of this project was that it did start in a day-long combined meeting between AUGS and IUGA, basic science special interest group members and basic science subcommittee members. And we were together all day thinking about this project and really trying to decide, what topics we really thought needed to be covered and explored when thinking about prolapse and stress urinary incontinence in particular. Dr. Alperin, who is the audience that will benefit most from this ebook? Would you say researchers, clinicians, students, or trainees?
I think that this ebook is appropriate for anybody, and all those categories that you included, and researchers and healthcare providers and students, our fellows, residents. Even if I think that the way you and I structured this is that while the ebook consisting of 4 chapters is a cohesive piece, also each chapter can stand alone. And I think that everybody can read it and get whatever they need out of it. There's lots of very important references and seminal studies in the mechanistic research devoted to prolapse and stress incontinence. There's also some fundamental knowledge information, especially valuable for our trainees on the, for example, mechanisms of the hormonal actions, or some biomechanical principles and concepts that can serve as a wonderful primer. So I think that depending on where you're at in your career and what your specific interest is, you can really get that information out of the ebook.
Another question, are there any other areas in urogynecology, other disorders that we treat, where you think it would be beneficial to have a shared disease model?
Yes, I absolutely think that. And as we had discussed in the past, while we devoted this first volume to the prolapse and stress urinary incontinence, given that these 2 conditions, while divergent in many ways, also do share some of the common mechanisms, we certainly think that, we're hoping that there will be a subsequent volume devoted to overactive bladder and interstitial cystitis bladder pain syndrome and conditions as such.
Excellent, excellent. In the executive summary, we call this a living ebook. What does that mean? And what can members expect from a living ebook?
What we're hoping is that the living ebook means that we can update the evidence summarized in there. And so it stays, hopefully we can embrace some of the up-to-date techniques of how up-to-date stays truly up-to-date. And while the basic science and mechanistic research doesn't necessarily move as quickly necessarily as a clinical research, now, I think that from time to time, and I'm thinking maybe in about every 5-year time frame, we're hoping to have an addition to the this first volume where we can get an important updates and highlight the studies that really continue to advance the field forward.
Excellent. Well, thank you so much for joining me and discussing this, what I call labor of love between the 2 of us for the past few years. And I just want to end with another quote from Dr. Delancey. You provided one, but he says towards the end of his foreword that he writes for this ebook, only by bringing the many accumulating data together and bringing them into harmony with one another can we form a theory of pelvic floor function and dysfunction that is true and not simply opinion or speculation. Thank you so much, Dr. Alperin. I really appreciate you joining me today.
Thank you, Dr. Northington. It's been a true pleasure collaborating with you on this effort.
Excellent.